Okay. Good evening, dear viewers. Welcome you all to the Eve Care and interactive webinar for obstetrics and gynecology enthusiasts. In today's session, following our pre-live session, we are having Dr. Sujata Kadam and Dr. Mridula Arvind with us to answer the queries posted by you all last 2 weeks ago. So I welcome Professor Dr. Sujata Kadam for the live session. Madam is the head of the Department of Prasuti Tantra and Stri Roga. Yes, madam. All India Institute of Ayurveda and also Dean of PG Studies of All India Institute of Ayurveda. I also welcome Dr. Mridula Arvind. Madam is consultant obstetrician and gynecologist at Milan Infertility Hospital, Milan Hospitals from Bengaluru. Welcome you, madam.
Thank you. Thank you so much. Good evening, everyone.
Good evening. We also have a special guest with us, Dr. Smrithi Nayak. Dr. Smrithi Nayak is consultant obstetrician and gynecologist and also an infertility specialist at Aster RV Hospitals, Bengaluru. Welcome you, madam.
Thank you so much. It's a pleasure to be here. Thank you.
Thank you. Thank you so much. So this is the first session where we have 3 speakers, 3 panelists. So it'll be, I hope it would be much fruitful session for you all viewers who had sent your queries. So in the past sessions, we had embarked on an NCD, that is polycystic ovarian syndrome. And it is time now we see into some other metabolic issues in obstetrics and gynecology. And when we speak of metabolism is something which is often ramped up during pregnancy, and it has to be checked for various possible deviations. It often presents as a disturbed glycemic index, which can have a multiple layer of considerations. So viewers, keeping the same as background, you will see a lot of questions answered for GDM. We shall also have a quick look at the ANC under the same and other closely related issues such as liver functions. So let me now not delay and take the first question for the day. And the first question is by Dr. Kajal Jaiswal. So the question goes to Dr. Mridula, madam. The question goes like, which women are at high risk of getting GDM and how does it affect the fetus and newborn? Mridula, madam.
Yeah, coming to the high risk women, the category of women who are at risk for GDM, there are, you can just remember it is 5, the most important risk factors. First one is obesity. Any women more than a BMI more than 30, they are at risk. Second is a strong family history of type 2 diabetes mellitus, type 1 also, especially in the first degree relatives. Third one is like previous history of GDM. The previous pregnancy, the mother has had GDM. Then previous history of big baby. For Indian standards, this is more than 4 kg. And previous history of stillbirth. And the fifth one is belonging, if the person belongs to an ethnic group which has got a high risk for type 2 diabetes mellitus. So and all Indians come into the high risk category because we as an ethnic group is at high risk for having diabetes mellitus. So these are the high-risk women who need to be, when we take the history, we have to recall all these factors and tick the boxes, whether they belong to this, in addition to the ethnic factor.
Yes, ma'am. And yeah, madam said about the high-risk group. The next question is from Dr. Jyoti Dalal. So now it is something with Ayurveda there. So we have our esteemed speaker, Dr. Sujata madam. This question goes to Dr. Sujata madam. What is the exact samprapti of gestational diabetes mellitus according to Ayurveda?
Yes, very good question actually. Because Ayurveda is not, in Ayurveda, we did not get the references about this GDM or very few references. I can, and not directly pathophysiological. There is no relate with according to the diseases which are described for in the under the Kachikitsa, what is prameha, and we have to correlate it with the GDM. So Samprapti is not totally going to change due to the Garbhini Avastha. Garbhini Avastha is not normal, but it is a little bit different from normal. And as you know, that yes, according what Dr. Mridula said, yes, rightly said that high BMI peoples are prone. And Ayurveda is saying before that yes, for any Vyadhi, Nidana Sevan should be there. So the lifestyle and whatever she is eating from long time, and it is not going to change in pregnancy. So the pathophysiology is already there with her diet and lifestyle. And the pregnancy is the condition where there is a rasa vriddhi for the garbhoposhana. And the prameya samprapti, the bahudrava shleshma and Kedar, these two factors are responsible for the GDM. And as the pregnancy advances, the fetal growth completes, or what it's going to have a dhatu paripurnata at the end of second trimester and in third trimester. So the mother sanchay from garbha is also accumulated in the garbhini, and the bahudrava shleshma, what is from her metabolism, is accumulating in her body, and which is a main responsible factor and ledadikya for the garbhini prameha. So
Yes,
we
madam.
commonly see prameha or garbhini prameha in late second trimester and third trimester.
Yes. Yeah. Thanks, madam. The next question is from Dr. Shivani Chaturvedi. So the question is to Dr. Mridula, madam. What pathogenesis would lead to fetal death in a pregnant woman having GDM?
That's a wonderful question, Shivani. So what we tell is about the this death in fetal death is termed as unexplained fetal death. Okay, it is termed as unexplained fetal death, and per se it is associated with frank diabetes or over diabetes than pregestational diabetes. But we can say that the most important correlation or some it is directly linked to your glycemic control. Okay, those who are having very high sugars in whether it be GDM or over diabetes, they have a high susceptibility to unexplained fetal death. And the name itself suggests it is unexplained, it is an enigma. We don't know. Usually it happens, it is very, scary. One of the things which all obstetricians dread. It happens usually after 35 weeks. No, late stillbirth, unexplained. And there's no confirmed pathophysiology has been found out, but there are so many theories regarding it. And the most important thing is like hyperglycemia. That is, whenever the sugars are uncontrolled for a long time, it causes a chronic aberration in the oxygen and acid-base metabolism in the fetus, which leads to a hypoxia, some level of hypoxia. So when the sugars remain uncontrolled, that hypoxia reaches a high level and can lead to stillbirth, fetal stillbirth. And another theory is like the high levels of sugar are cardiotoxic. But why? The question why it happens in late term and also suddenly, that is an enigma. We don't know. There are no theories which has been proven yet. But yes, these are the existing theories to explain unexplained stillbirth.
Yes, madam. I also request Dr. Smrithi, madam, to add your view if you have some on this, madam.
Yeah, so like how Dr. Mridula mentioned, this is a very scary complication because we get patients who are at term and they come with decreased fetal movement. So that is why I want to add a point that fetal movements is extremely important for every pregnant woman, especially with GDM. They have to monitor the fetal kick chart, and when they feel it is reduced, they need to report to the hospital immediately and not wait for too long. So this can be monitored through serial scans where a patient with GDM will have increased abdominal circumference as well as polyhydramnios. So with polyhydramnios, the problem is that with so much liquor around the baby, even the movements, are not felt very well by the patient. So we always insist that the first person who gets to know that something is wrong with the baby is the mother herself. So if there is decreased movement, they should not ignore it and report to the hospital immediately, especially if they are, having gestational diabetes mellitus. This is what I wanted to add. Thank you.
Yes, yes. Thanks, ma'am. The next question, Dr. Mridula was mentioning about obesity. So, madam mentioned obesity. So, there's a question related with that. And this question is to Dr. Sujata, madam. So, the question is from Dr. Daritri Purohit. So, the question goes, GDM is equivalent to Prameha. Then, if Garbini Stri is Sthula Pramehi, then we should, according to Prameha Chikitsa, give Apatarpana Ahara, while a Garbini requires Brahmana Ahara. So, what can we advise?
This is actually the treating Garbhini Prameha is a very tricky situation. And that's why the text in our text it is mentioned that any disease in Garbhini that is very difficult to treat and you have to treat it very carefully. And that's why they have given the example of Taila Purna Patram. So these Prameha-like conditions are exactly the same conditions where we have to be very cautiously treat the patient. Though the Prameha Vyadhi is treatment is Apatarpan, we should not adopt any Apatarpan in Garbhini because Apatarpan Ayogya, the Garbhini is Apatarpan Ayogya and Bruhan Yogya. So we have to select a drug which are Bruhan, but still they are Laghu and Supacha. So instead of Masha Mudgayush, you can switch over to only Mudgayush. Like this, you should not adopt Apatarpan anywhere in the Garbha treating any disease. The Garbhini is only a Bruhan Yogya Avastha. So you have to take care of it, like while selecting a drug or while advising a diet, you should look that yes, they should be Bruhan, but they still should be Laghu and you can add the deepened drugs to digest those things also. So this is a common treatment protocol for that.
Yes. Okay, madam. Yeah. So the next question, along with GDM, there are certain conditions. So the question is from Dr. Divya Agarwal. So the question is to Dr. Mridula. The question goes like, how can we manage if patient who is a GDM has thyroid and hypertension?
Okay. So first, it can be two scenarios. First one is when this happens as a part of the metabolic syndrome, that the woman is already known case of GDM, type 2 diabetes mellitus, and along with it, she's having thyroidism, obesity, and other autoimmune disorders. So that we have to be a little more careful. We have to, if she has not been evaluated properly, we have to see for the anti-TPO antibodies also, because their prognosis is little, more dangerous, and then we have to keep a very keen surveillance on them. Surveillance should be more adequate. Their ANC visits should be more. And the other scenario is where then, GDM mother who develops GDM goes on to develop preeclampsia and there is association with hypothyroidism. The text doesn't say that GDM as such is related with hypothyroidism. But in case of preeclampsia, yes, GDM mothers are more prone to develop preeclampsia or gestational hypertension, that hypertensive disorders of pregnancy. So we have to be very vigilant regarding their monitoring during ANCs. Keep a watch on the excessive weight gain and increase in, BPs. The base, you should know what is their baseline BP and monitor the BPs also. If you catch them early, you have to start them on labetalol. Like, the management of preeclampsia remains the same, but GDM plus preeclampsia, it is a very tricky situation. Their surveillance needs to be very, very, stringent. We need to follow up them with regular scans, because usually GDM is associated with a big baby. But with preeclampsia, there is a chance for IUGR also. So multiple risk factors and multiple complications come. Hypothyroidism, the thing remains the same. Depending upon the thyroid levels, we need to add on Thyronorm and go on repeating it. and to see how and to make sure that they adhere to their medications. Preeclampsia and GDM is a sinister combination. We have to be very careful. Their INCs have to be more frequent.
Okay. Yes, madam. The next question is to Dr. Sujata, madam. So, madam, in her slides while explaining about the GDM, madam had mentioned a simple but very effective formulation called as a simple one, Udakapana, that is medicated water with Vijayasara. Udakapana, that is Sarodaka Udakapana. So, the question is to Dr. Sujata, madam, by Dr. Priyanka Hajare. So, madam, what is the mode of action of Udakapana Sarodaka in Garbhini Madhumeha?
Yes, Vijay Sar, it is used for the, not only for Garbhini, but regular Pramehi patient can also drink this. You have to put 2 or 3 small pieces you will get in the market of Vijay Sar. You have to put the 2-3 pieces of Vijay Sar, what you are getting in the market, put it at the night in 1 glass of water. And in the morning before breakfast, you have to drink it. The Vijayasara properties are anti-hyperlipidemic and it increases the insulin receptivity of the cell. So it is a very good anti-diabetic drug. And actually, you can get the pots of which are made from the Vijayasara wood. So that can also be used. You have to put the water in that particular pot, put it overnight and drink it before the breakfast. So it helps in digestion of the glucose. It increases the insulin receptivity of a cell, and it is also a very good anti-hyperlipidemic. So many papers you will get regarding this Vijayasara on Google, and it's a very good to be rather than drinking a normal water, she can take a Vijayasara or Sarodak to drink early in the morning.
Okay, thank you, ma'am. I hope this would be a very simple formulation, and even Dr. Smrithi and Dr. Mridula, madam, would also try this simple medicated water. I guess Mridula, madam, in Kerala, most of them have the habit of drinking medicated water. So this is one example where we give it for a pregnant lady, which is proven, and there are many research papers for this also. Yeah, let's go to the next question. The next question is to Dr. Mridula, madam. Madam was telling about insulin receptivity and all, and we also know that during pregnancy, if there is diabetes, we go over insulin. So the question is from Dr. Shibani Das. The question goes, those who have undergone through insulin during gestation for GDM management, is there any effect on fetus in future life?
Absolutely not. Nothing to worry about, Shivani, because insulin doesn't cross the placenta. So it doesn't have any effect on the fetus. So you can go ahead, and insulin is the most physiological thing that we can give to the mother, because whatever insulins we are using is like the human recombinant insulin. So it is a physiologic, it's basically the same insulin that we are providing to the mother. But usually the first step is to give oral hypoglycemic agents like metformin, because it is tedious to get injected, give injections every day, and the thing of hypoglycemia also. So nothing to worry. It doesn't have any effect on the baby. No worries in that aspect.
Okay. The next question is something which is related again with insulin. The question is by Dr. Srinidhi. So madam is asking question to Dr. Sujata Kadam. Ayurvedic management of insulin dependent GDM.
See, there is nothing different management which is for the insulin dependent diabetes. The regular management of Garbhini Prameha what we are adopting, we just have to check the glucose level, particularly when we start like add-on therapy or supportive therapy of Ayurveda with insulin therapy, whatever she is taking. If you want to add on, you have to closely monitor the glucose, because sometimes there is a synergistic effect and suddenly the glucose level can fall. So you have to be careful while selecting the drug. Start from a very simple drug like Guduchi or Nishamalaki combination or Sarvamehar Kashai combination. But you have to closely monitor, because sometimes with your drug, that insulin dose may be or can be reduced with our treatment. So for reducing this dose of insulin, we have to closely monitor this glucose, and slowly we have to taper it, and we have to add on our drugs. And you can shift the patient with close monitoring from the insulin to our drugs if the glucose level is very nicely controlled with our drugs. So nothing special, but you have to monitor very closely the glucose levels of the patients.
Okay. Yes. There is again, madam, there is another question for you. Generally, when there is a diabetic patient, we ask them to cut off their sugars, and we advise them to add honey instead of sugar. So this is very common nowadays. We ask all the diabetic patients, they generally, we say, add sugar, add honey instead of sugar. You can go with honey. So the question is from Dr. Shivani Gupta. So I guess you would be the right person to answer this. Is honey safe in GDM?
Yes, previously it was safe. Because now honey, what we are getting in the market, may be the sugar, liquid of sugar. So sometimes it is not advisable to advise the honey instead of sugar, because the sugar is only in the water form. But if you are getting a very pure honey, that is the source from which you are taking the honey, if it is very good source and it's a natural honey, then you can surely advise, because honey is a nectar of various plants, and you know that all the qualities of all plants are there in the honey. And Ayurveda persons all know that honey is a Anuras is a Kashaya, Rasatmak, and Kafagna also. So it's very good for and Prameha to supplement this instead of sugar, to supplement this honey. As should be taken in whatever, if she is craving for very sweet things, she can take a honey, surely.
Yes. So honey, if it is pure, then it is completely advisable. If not, better restrict
Yes,
from using
completely.
honey.
You
Yeah.
can. Yeah.
Yeah. Yes, madam. Yeah. Then now the next question is to Dr. Smrithi. Dr. Smrithi, madam, the question is from Dr. Divya Agarwal. The question goes, what would be the treatment if a patient having raised LFT along with increased insulin level?
Yeah, so increased LFT is always a very challenging situation in obstetrics, because we have seen increased sugars, increased BP, but when it comes to liver dysfunction in pregnancy, the prognosis is usually poor. So liver is the major site of insulin action and clearance. So it plays a very important role in insulin hemostasis as well as that of glucose. So when there is some liver dysfunction, we know that we need to deliver soon, and we should not, sort of postpone the pregnancy. There are usually four conditions that we can think of when we talk about increased liver enzymes. The first one, which is quite benign, is intrahepatic cholestasis of pregnancy, which we have seen quite commonly. It is the second most common after viral hepatitis, and that can be dealt with quite easily by giving tablets, which is also deoxycholic acid, and it helps in improving in reducing the liver enzyme. It usually presents as itching all over the palms and the soles. The most grave sort of problem that we see with when it comes to liver disease is acute fatty liver of pregnancy. Here, there is a lot of things at stake, because the maternal health deteriorates very fast. So we have to deliver and terminate the pregnancy, because that is the only way in which the condition can be resolved. So in these cases, we have to understand that GDM comes secondary. We have to deal with increased liver enzymes first. And as a consequence, actually GDM is produced, because patients who have liver dysfunction in pregnancy, actually are more prone to developing non-alcoholic fatty liver disease later on in life. So patients with GDM and liver dysfunction, we know that even after the pregnancy is dealt with, later on in life, they can still have some remnant liver problems. So they have to keep undergoing constant screening as well as checkups to make sure that they don't land up in that sort of trouble. Having said that, if it is less than 32-week pregnancy, then we need to counsel them about the poor prognosis for the baby, because we have to do this to save the mother in case of very deranged liver function tests. But anything above 32 to 34 weeks, we can at least try to salvage the baby. So ultimately, delivery is the option when it comes to very acute sort of increased liver enzymes. And of course, HELP is something that we all know about, where there is hemolysis, elevated liver enzymes, and low platelets. Again, there we need to quickly decide on the management, and again, delivery is the main option here.
Yes, thanks, ma'am. Can I have Dr. Sujata madam's view on the same question, that is treatment if a patient having raised LFT along with increased insulin levels? How Ayurveda, what Ayurveda could offer for this?
Yes, many times we can get such type of patients where liver function is deranged and having also GDM. We have to select a drug which are anti-diabetic also and are working on liver function or to correct the liver function. So we have to take such drugs that will act on both the things, like Darvi or Darvi and Shunthi combination, Darvi Shunthi Guduchi combination. This works very nicely with the deranged liver function, and these drugs are also Pramehagna. So in combination, you can use the drugs which will act on both the things.
Yeah, yes, madam. So madam has given the examples, a few formulations for the use in raised liver function tests in pregnancy. The next question is to Dr. Mridula. The question is from Dr. Divya Agarwal. The question goes like, what are the warning signs of GDM, and at which trimester we can properly diagnose it?
See, coming to the diagnosis of GDM, it is unlike preeclampsia where we have a definite cutoff. Like after 20 weeks, we diagnose it as preeclampsia. It is not like that in GDM. Okay. It is basic, as the definition says, it is any degree of carbohydrate intolerance during first recognition during pregnancy. So according to Indian guidelines, we have to test for GDM. We have to screen and diagnose GDM at the first antenatal visit. It has to be on the first antenatal visit. In case if the test tells her she is not for type 2 diabetic, or she doesn't have any deranged sugar values, then we have to repeat it again at 24 weeks. I think that's what she meant. Which trimester we should do it? Only after 24 weeks, because anything, if it was normal in the beginning and we have to choose a time when we expect it to be abnormal. 24 weeks is the time when the placenta is completely formed, the pregnancy hormones are in the peak where it can act again as insulin. So we should be able to diagnose it at that time. In case the OGTT is normal at that time also, we have to repeat it at about in between 28 to 32 weeks, I will say. We have to repeat it. After that, there is no point in giving. After 34 weeks, there is no point in doing an OGTT if you get any warning signs. Like she asked, like, what will be the warning signs when you do an abdominal palpation, you see that the fundal height is more than that. From the clinical point of view, fundal height is more than the gestational age, or the abdominal, there is more LICA, which has been ascertained by a scan. When the scan says the baby's weight is more than the expected, it is suggesting an LGA baby. The LICAs are increasing, you have to think about GDM. And those are the main warning signs of GDM.
Yes,
Clinically, if you ask me.
Okay. So probably we are coming to the end of the session. So mostly another 2-3 questions we have. So the next question is from Dr. Jyoti Dalal and also Dr. Mithuna Shri. So both of them have a query, and the question is to Dr. Sujata madam. How can we prevent gestational diabetes mellitus through preconceptional counseling and care?
Hello.
Yes, madam.
Dr. Shreyas, can you repeat the question?
Yeah, this question is, how can we prevent GDM through preconceptional counseling and care?
Yes, as all of us know that Garbhadan Sanskar, that is preconceptional care or counseling, that is a very strong point of Ayurveda, that Ayurveda is always aimed towards planned pregnancy. Ayurveda don't want a accidental or unplanned pregnancy to be happened in couple. So the planning of conception in all aspects, that couple should enter the pregnancy in good physical, mental and spiritual health. And then only the Supraja concept of our, that is Sri Prasuti, will be there, that couple will have a very good physically, mentally and spiritually healthy child when the couple enters in the pregnancy in very good healthy state. So to achieve that, they have given the Panchakarma Upachar Shodhan, then a very good lifestyle to follow before the pregnancy, and some rituals before the pregnancy for mental readiness for the pregnancy. So yes, surely where there is a history in family history is there in a couple of like diabetes, history of diabetes is there in family, or the couple is more obese, then predisposing factors are there, like she was having GDM in first pregnancy, or maybe having a history of IUD in previous pregnancy. So that couple should definitely go Panchakarma Shodhan before the pregnancy and follow the lifestyle adaptation which is healthy for the coming pregnancy. Before at least 6 months before the pregnancy, they should plan the pregnancy and follow all advices regarding the Panchakarma Upachar and lifestyle and diet, everything. And we can give some treatment for the enhancing quality of ovum and sperm during this period, and that will definitely reduce the chances of GDM in coming pregnancy. So the preconceptional care that should be followed, I think this is a very good option to prevent a GDM, and this should be adopted by every Ayurveda obstetrician.
Yes. So madam was telling that prevention is better than cure. Instead of looking for answers for the treatment of GDM, what if we start preventing GDM? Probably it might take years to do that. Like once if we adopt a lifestyle of a healthy lifestyle, along with the Panchakarma Shodhana, the Rutu Shodhana, or the quality lifestyle, probably we could prevent GDM. Yes, no, ma'am? You were about to say something else?
One more thing I want to add, one more thing. Yeah. That with this we can prevent diabetes in coming generation also. Actually, that we should plan some studies like this, that a couple is prone to diabetic. We have given the preconceptional care and Shodhana to this couple, and the coming generation, whether they are having the diabetes or not, or maybe the diabetes is prolonged. So in coming generation also we can prevent a diabetes with this all preconceptional care which is described in Ayurveda, because with the Shodhana Karma we are doing a Bija Shuddhi. So exactly. That may prevent the diabetes in future generations also.
Yeah. For Dr. Smrithi madam and Dr. Mridula madam, so madam was mentioning about Bija Shuddhi, that is improvising the quality of the ovum and quality of the spermatozoa. So Ayurveda has also certain therapies and remedies where we also go on the quality, not only the quantity in increasing, with also the quality. So probably Panchakarma, which mostly I guess all of you have heard of Panchakarma, adopting Panchakarma is one for prevention. So the next question to Dr. Smrithi madam. again, a question for preventive aspect. The question is from Dr. Shivani Gupta. The question goes, what should we do to prevent GDM in next pregnancy if she had suffered from GDM in her previous pregnancy?
Okay. Yeah. So the chance of recurrence is around 30%. If you've had GDM in your previous pregnancy, so the next pregnancy, what are the chances you will get it? So that means there's still a 70% chance that you might not. So what can you do to not get GDM again? Is definitely like how Dr. Sujata mentioned, is you have to be physically as well as mentally prepared. Right, sorry. So like I really liked how Dr. Sujata put it. You have to be in the right physical, mental, and the spiritual place, to enter into a pregnancy, which we don't see nowadays because couples are living such a fast life. They just want to be done with it. So that concept has, just come about. Let's just get done with it. We'll come for the treatment and we'll finish it. But I think that's very important. You need to be mentally, ready to embrace becoming a mother and parenthood. So preconceptional counseling is a very important part of getting pregnant. And in that, especially if a woman has had GDM, then the weight is crucial. We end up stressing so much on the lifestyle, but patients don't seem to realize how important it is to be in the right BMI. So body mass index is extremely important. I think all of us should know our own body mass indexes and make sure that we fall in the right, right range, which is around less than 25. So it's an easy calculation. You get your weight in kg divided by height in meter square, and you get your BMI. So for any person who comes to me for preconceptual counseling, I always insist that they go into the right range of BMI and to lose that much weight, because they always have that question of how much weight should I lose, because I've been trying, I lost 1 kg last month, but now I gained it. So you need to get back to that right range to start trying for pregnancy. And apart from that, I also insist that they get into a good diet and a good exercise regime. I insist all the couples to not stop exercising once they conceive, because that again happens a lot. They think that if they start exercising, they're going to lose the pregnancy, which is a very wrong notion. Doing some physical activity always helps in good blood circulation and just generally a feeling of well-being. So never stop exercising if you end up, conceiving. So exercise, a good diet, as well as getting back into a good range of BMI always helps. Other than that, I think I also want to call out to all the patients with PCOS, because they are always prone to get GDM in pregnancy because of the insulin resistance. So all PCO patients, when they try to conceive, please try to lose weight and then only get pregnant, because it really saves you a lot of treatments that you might end up getting in pregnancy because of developing gestational diabetes mellitus. So, and also a thing about Panchakarma, I've actually tried it myself and I think it's wonderful and I recommend it to a lot of other people. Like it really helps in detoxifying. I think it's a wonderful way of just sort of understanding your body and getting the toxins out.
Yes, very nice, very nice. Thank you, ma'am. And Dr. Mridula, madam, do you have any views on this? How do we prevent GDM in
I
next pregnancy?
wholeheartedly agree to what Dr. Smrithi and Dr. said, because preconceptional counseling is an absolute must, and I believe that no pregnancy, as ma'am said, no pregnancy should be unplanned. A healthy mother, a couple can make a healthy baby basically, and Ayurveda is the best thing that we have to cleanse our body, like, and all those things can be done in the preconceptional period, especially when the mother has had a GDM in the previous pregnancy. They have to monitor. Most of the people, what they do is, like, once we discharge from them, maximum they will come to us at the 6th week, and we do FBS, PPBS, and tell them, okay, you are fine, you should follow. But most of them don't follow up with what you tell them. But it's imperative that they follow a life, and it has to be a lifestyle modification. It is not a short-term thing where you do something to achieve a goal and then leave it. That is why it is called lifestyle modification. Your life has to change in all ways. It has to be incorporated into you. That way we can, to an extent, control, as Dr. Smrithi said, lifestyle modification in the way of you being keen on what your BMI is, maintaining your normal BMI. If you are obese, bring down the weight And then measure your sugar levels also. And before you conceive, you make sure that your HbA1c is in the normal range, because otherwise not only GDM diabetes, we are going to the problem with fetal anomalies will be there, because any GDM mother during their lifestyle, they have a 50% increased chance of developing type 2 diabetes mellitus in the next 10 years. So they have to be very careful in that aspect. Exercise, the minimum, most of the mothers stop exercising once they get to know that they are pregnant. And add on to all the other stress, they end up being diabetic, and the incidence is increasing day by day.
Yes, thank you, madam. And I also ask Dr. Sujata, madam, to conclude the session with this, the advice, what she would give. Madam had already said about preconception counseling care. Any other words if you have, madam? How do we prevent GDM in the next pregnancy if she had already a GDM in her previous pregnancy? Any medicine, simple remedies, simple recipes like that?
No, simple recipes, improve your lifestyle. That's the only thing, because Nidan Parivar should be always there. The first step of the treatment as per Ayurveda is Nidan Parivarjan. So Nidana is the diet what we are eating and the lifestyle. So it should be corrected at the it's the very initial state to prevent the GDM like cases. To you have to change over the your lifestyle and diet and eat what is healthy and adapt a lifestyle what is healthy. And yes, the pregnancy should be very much planned, and all the things can prevent GDM, and the incidence we can reduce very well with preconceptional care, a very good healthy lifestyle, Panchakarmopachar Shodhan, and the treatment, our Garbhini Paricharya, the good adaptation of Garbhini Paricharya, whatever there. And yes, we can add a yoga practice in it while adapting a Garbhini Paricharya, though it is not written in our Garbhini Paricharya, because we are now integrating all the things in Ayurveda, and the yoga is a part of Ayurveda. So we can adapt a good exercise with yoga and pranayam that also can reduce mental stress, tensions, and that can help in reducing the blood sugar during pregnancy. So very good preconceptional care and counseling that will definitely reduce, and the adaptation of Garbhini Paricharya with diet, lifestyle and exercise that will reduce the incidence and will reduce the mortality and morbidity both.
Yeah, yes, ma'am. Thank you so much. So there was a lot more questions, but due to the time constraint, we have taken only so many questions. So thank you, Dr. Sujata, madam, for being with us. And thank you, Dr. Mridula, madam. And thank you, Dr. Smrithi, madam. So now I request our product manager of Himalaya Drug Company, Dr. Wahid Pasha, to come on live.
Thank you for inviting us.
Pleasure, ma'am. Pleasure.
Thanks a lot.
Yeah, madam, Dr. Wahid sir would come and speak to you all. Yeah.
Good evening, everybody. Am I audible there, Shreyas?
Yes. Perfect.
Okay. Let me share my screen first. Good evening, speakers. Good evening, Dr. Shreyas, and good evening, viewers. I hope I'm audible there.
Yes, sir. Yes, sir. You're audible.
Yeah, thank you. Sorry, I had a little network issue, so I just wanted to test it out first.
Yeah.
Good evening, viewers, once again. And we have now come to the end of our sixth session for the webinar series, Eve Care. I think we have been fortunate enough today to have three speakers instead of two, as always we have had a practice. I think that compensates for missing out the previous session So, the foremost, I'd like to express that it was a wonderful session, a whole lot of very important questions, regular queries were answered by our speakers, and I'm sure it will add a lot to our viewers' clinical practice in coming days. I'm sure you all agree that somewhere in the discussion of all the speakers out there, what we found was it had a common denominator, and the common denominator was metabolism. Hence, the topic of the session was kept as metabolic disorders in OBG, with a prime focus on GDM per se. If I may take a few cues from our speakers and present to you a few couple of inputs out here. So we were talking about metabolism as a common denominator or underlying factor for a host of factors, GDM incorporated out here. I'm sure you all will agree that metabolism also has two more arms or two more extensions of it, and that is detoxification and homeostasis. Rather, they go in a vicious circle. In Ayurveda, we've got the three humors, three doshas, Vata, Pitta, and Kapha, which help us balance these at any given point of time. Now, when we talk about metabolism, when we talk about detoxification, homeostasis, a number of organ systems come into picture. The primordial of one probably is liver, and I'm sure all of our viewers would agree with me on this here. So I would be going a few steps back from the discussion that has already happened, and I'd like to take this opportunity to look a little into the liver per se. This is very interesting, viewers, and I think we should spend some time of ours in trying to understand this pathophysiology happening inside the liver. So, in a nutshell, this picture here showcases to you what is happening in a hepatocyte on a regular scale. So, hepatocyte, major composition of the liver, the liver cells, and then you've got the other organ systems in place. You've got your arteries et al. And there is one more very important component of the liver, and that is the adipocyte. Now, this adipocyte is basically a necessary evil. It ought to be there for a whole lot of very important physiological consequences to happen. But at times, on account of various factors, lifestyle to diet to various unavoidable circumstances, even genetics might be playing a role. We are yet to understand the entire of it today. So all of this come into picture, and what we have is a little deranged adipocytes. What do I exactly mean by this? I'll come down to this as I move into my presentation. So we've got hepatocytes and we've got the adipocytes, which were supposed to be there, but when they transcend their presence, when they get in excess, and why and how they get in excess is a big question to be answered, which has a whole lot of inputs to it. But here I'd like to introduce you all to a very interesting term that goes by the name de novo lipogenesis. De novo is a French word which basically means creating new. So this is once again necessary, but it keeps happening into the liver. So why is it required? For various physiological functions that we are aware of, right, from cholegogic to choleratic and so on and so forth consequences. Now, this de novo lipogenesis, when it is happening at an apt level, it's fine. But when it once again overshoots its presence out there, what we have is an increased oxidative stress and inflammation. Dr. Sujata ma'am rightly pointed about Shodhana Karma, Pancha Karma that we talk about. And this on a regular basis helps us keep these two factors in check, the inflammation and the oxidative stress. But here is another third component, very, very important and essential, and that is the insulin resistance or insulin sensitivity, in other words. So it plays a pivot for managing the rest of the three, the de novo lipogenesis, inflammation, and oxidative stress. And a combination of all of these four factors results in a reduced lipogenesis. Consequence, what we have is the free fatty acids floating out. So this kind of a presentation can come across in many clinical presentations. It can be a part of your cardiovascular issue. It can be a part of your NAFLD, non-alcoholic fatty liver disease, which I'll come down to. It can be a part of your diabetes. I'll come down to that as well. And very interestingly, it can also be a very, very important part of the presentation pieces, which was discussed in the sessions before, and rightly pointed by Dr. Smrithi during her answering of one of the questions as well. So this is basically happening in the liver. So we have increased oxidative stress, we have increased inflammation, we have increased insulin resistance, and the de novo lipogenesis is also on the rise. Well, it all leads to increased free fatty acids. So it's fine as long as it is within control. But when it exceeds, the liver's fat component, when it exceeds beyond 5%, the patient lands up with NFLD. And as rightly pointed out by our speakers, it was very good to note the amount of emphasis they laid on the preconception concept, Garbhini Samskara, much before that as well. Preparing the couple for conceiving, addressing this particular pathways can bring about a whole lot of better outcomes in the pregnancy as well. Let us see if it really makes an impact. So, what are my objectives when I'm trying to address the entire cascade that we learned in the previous slide? I can put it down in two major requirements. First, you restore the lipotropic factors. Number two, arrest the progression of the disease. How do I do it? I've given you a whole lot of hint on it. Trying together now. So we need to address the de novo lipogenesis first. You need to reduce it. How do I bring about this happening? There's a very, very interesting pathophysiology here, and that is mitochondrial fatty acid oxidation. I'll come down to this in the next slide. There's a very interesting information on this part. The next is decrease inflammation. Do we have something for decreasing inflammation? Unfortunately, we do not. We are still, yet to find, especially in the contemporary science, we are yet to find a hepatospecific anti-inflammatory drug. There are a lot of proposals, but yes, they're probably not, still convincing. We do have a good deal of inputs for managing antioxidants concern or decrease the oxidants. Vitamin E is available, which can also be sourced in our food. Interestingly, the preconception care encompasses this. And last and very, very importantly, you need to mobilize the free fatty acids. How do I do this? I'll come down to this in the next slide. As a consequence of this, what you have is a better cholagogic consequence. You have a better cholinergic action happening. And once the fatty acid oxidation or the fatty acid metabolism is put in place, the insulin starts to give a better response. So you have a better insulin sensitivity or a reduced insulin resistance per se. So how do I go ahead achieving this? I'll come down to this. So as I promised, we're going to talk about this mitochondria now. All of this pathophysiology that I'm hinting towards, probably a common denominator, is termed as non-alcoholic fatty liver disease. As the name, it's very self-explanatory. You've got more fat, more than 5%, and it need not necessarily have alcohol, like supposed to be one of the primordial reasons, need not be always a concern. It can always happen in a person who's not consuming alcohol, and hence it's called as non-alcoholic as well. So there's a whole lot of research happening with non-alcoholic fatty liver disease and mitochondrial dysfunction. So to cut the long story short, I'd like to give you a reference of a very interesting research paper, which is titled as Mitochondria Sky. This is published in Genetics, and it's done by Dr. Douglas C. Wallace, a very interesting scientist. Now, what he means to conclude in this study was very simple. He said that when you present any drugs to a mitochondria, especially the synthetic variants, the mitochondria is often confused with it not being a part and parcel of the system. So it often lands up your patient into having deleterious consequences. It includes, from supplements to synthetic supplements to antibiotics as well. So when he presented a few herbs, what he found was the alkaloids were well accepted by the mitochondria. And here he talks about mitochondria sky, which is basically energy, a Chinese term for energy. So regulating this mitochondrial dysfunction or enhancing the mitochondria's work in helping you address the fatty acids composition available or discharge the fatty residue available, this comes into picture out here. And since we have been discussing GDM, the sad story is GDM is also strongly associated with NFLD. A lot of research papers are available on this. I'm sure our speakers would vouch for this as well. So in a nutshell, non-alcoholic fatty liver disease or fatty liver, mitochondrial dysfunction, and GDM, not just in GDM, but also in PCOS, in various other disorders, metabolic disorders, this forms oftenly a common denominator. So what do we do about this? I think I'm really fortunate enough to work for a company and also fortunate enough to be on this platform to present to you a product by name Lay 52, which also is a very popular front-end brand. We have been having this in the market for about over 65 years now, and it's been a part of prescription from consultants and from practitioners across all spheres of practice across nation. At any given point of time, 1 unit of Lay 52 is bought by, utilized by some person who wants to address his liver care. So, what is it about this particular brand that makes it useful in today's discussion? So, if I can, make it a little more easier and have some carry home message, this would be something that I like to reiterate. We have one variant of Lay 52 which goes by the name Lay 52 DS. DS stands for double strength out there. We have seen in the due course of discussion, the fatty liver has got addressed to be done, the increased de novo lipogenesis, and we have seen how how mitochondrial fatty oxidation is capable of doing this. We've got some studies done recently and which have confirmed that this particular product is capable of pushing, and if I can put it in a very simple terms, pushing this free fatty acids into mitochondria so that they're burned off for producing energy. This happens much better when you club this with addressed lifestyle disorder. Now, for instance, bring about exercise, bring about diet moderation. It's better. So there is an increased inflammatory cytokine happening in the fatty liver. Cytokine storm has been in news for the given prevailing COVID times. So Lay52DS has been known to influence interleukin 6 and TNF alpha also, that stands for tumor necrosis factor. So it can be a very potential anti-inflammatory when you're addressing a hepatocyte in specificity for which there's a dearth of molecules available. We've spoken about insulin sensitivity. We do have studies which have promised, which have been really encouraging in showing that there was a decrease in insulin resistance, thereby increasing insulin sensitivity. So we've got this very important addressable cover, which was pointed in the discussion. As a consequence, you have lipotropic factors which were compromised, which can be regulated as well. So this is about Lay52DS, which can be a part of your entire presentation, entire clinical conditions which were discussed, starting with where you want to address about in preconception, during ANC care. It's very safe to be recommended in pregnancy beyond first trimester. It can be a part of your PCOS management for the given consequence it has. It can give you better outcomes. Of course, we've got Eve Care Fort, which is exclusively devised for managing the other important addresses in PCOS. So combination of these therapies can also bring better results. This is once again communicated to us by a whole lot of gynec practitioners across the country. And needless to say that it will definitely impact the liver dysfunction, definitely will influence the BMI, the non-alcoholic fatty liver disease, one of the very important denominators that we spoke about. It can certainly be a part of Panchakarma, left to the Court of Justice, to the Ayurveda specialist out there who would like to incorporate this for given these consequences. In a nutshell, it can bring about addressing the two important humors of doshas, kapha and pitta, which form a notorious combination in a fatty liver presentation. What does it hold for us in pregnancy? As a consequence of all of these studies and the discussions we have made, Lay52DS can help us modulate lipotropic activity, thus preventing fatty infiltration. If that is a denominator for GDM, yes, it can be a part. We recommend the Lay52DS tablet out here. It regulates bile flow and corrects metabolism, which will help you overcome common presentations like ranging from constipation to even addressing the morning sickness or nausea, vomiting, acid. It stabilizes ALP, so there's good anti-inflammatory component added out here. Improves digestion and bowel movements in your patient, thereby helping you achieve better outcomes of the a nutrition supplementation that is a part and parcel of the ANC care per se. So live through DS can definitely be a part of better pregnancy outcome. I'd like to propose this to our practitioners of OB and Gynec as well for the other consideration that we've spoken about. We also recommend this in NFLD, today also termed as MFLD, non-alcoholic fatty liver disease, or uh, metabolic fatty liver disease as well. And we also recommend this as a co-therapy whenever you have any long-term therapies happening, wherever you find a possibility of ALP to rise. It can be long-term antibiotic regimen, as in anti-tubercular treatment, or as in a long course of antibiotics given during hospital stay. That can definitely be a part of treatment there to ensure a better quality of life for your patients. So I'd like to take this opportunity to recommend Live to DS to all of our viewers, especially in the pregnancy care, Live to DS in specific, and for NFLD as well. For those of your regular liver care concerns, like infective hepatitis, loss of appetite in a general populace, we've got Live 52 available in form of plain syrup and tablet as well, that can also be explored. Of course, in alcoholic fatty liver disease as well. Last but not the least, we also have the drops, which can be used in pediatric care in the infants as well. It is very safe. Just to support my claims out here, we have a study by Arun Kumar Mitra, which was done in 84 patients with liver disorders in pregnancy. What we found was after 6 weeks of treatments, 82% of the cases were relieved of the complaints. We had liver biopsy performed in 21, of which 15 showed normal restoration of normal architectural restoration and regenerative nodules. And LFT parameters were improved, which was one of the major concerns that was put forth by our speakers as well. And very, very importantly, there were no toxic effects. It is considered safe. We've got also the teratogenicity studies done for the product. So it's a safe product to be put to use in various liver concerns, ranging from infective hepatitis, alcoholic or non-alcoholic fatty liver disease, or your liver care in pregnancy as an adjunct in long-term therapy, so on and so forth. So I'd like to take this opportunity to extend a heartfelt gratitude and thanks to all of our veterans who have been on board. We have had very encouraging organic views on YouTube channel where we have been streaming it, and also on Facebook. So I'd like to take this opportunity to thank all of our viewers and our patrons for the channel. Thank you so much for viewing us. And before I take your leave, on behalf of the corporate and on behalf of the team that is organizing this entire webinar, I'd like to take this opportunity to thank firstly Dr. Sujata Kadam Madam. Despite very busy schedules, you could make it once again to our session. Thank you so much for accommodating us once again. And I'd like to express a heartfelt thanks to uh, Dr. Smrithi ma'am. You joined us on very short notice. It was very nice to have you on board. You shed a lot of important light on many faces that I wanted somebody to speak, and you came in as a blessing for me today. Thank you so much for being on board with us.
Thank
And
you so much.
thank you, ma'am. And last but not the least, Dr. Mridula, ma'am. Thank you so much for making your presence here. It was wonderful having met you. And thank you so much for shedding light on so many very important considerations of GDM management in pregnancy. GDM management. I'm sure our viewers would definitely benefit out of all of your inputs, all three of your inputs. And I'm sure we can look forward to providing better healthcare to masses, integrating at the level of preconception care, provide a better fertile ground for your patients to conceive, and thereon supplement them with appropriate therapies and bring better outcome for our patients who want to have a healthy child, future, a healthy future for the nation as well. So thank you so much, one and all. And Dr. Shreyas, thank you so much for hosting the entire show for us for the 6 sessions. Wonderful job there. And thank you so much for letting me on board to share some of my views. And thank you so much for your time. I think I've exceeded my time today, but thank you so much for listening to me patiently. Thank you, one and all.
So much. Thank you so much for the great opportunity.
Thanks.
Thank you. Thank you,
Thank you.
madam. Thank you, sir. Yeah. Dear viewers, we have almost completed 6 informative, educative sessions. And thanks for the corporate Himalaya, and special thanks to Dr. Wahid, product manager of Himalaya Drug Company, for organizing 6 such very informative webinars on integration of medical sciences in OBG care, a future prospect. So for the next, what we have for you, you will have to share the link and subscribe the channel for further updates. Keep following us so you would be informed what next is going to happen in this channel. So till then, have a very good night. See you all soon.